to know about MBA very late in, well after medical school. So I didn't realize about MBA before. So that's great. Thanks.
Yeah.
Thanks, Todd. Really looking forward to your talk.
Yeah.
Depending on
Well,
that, I will do MBA or not. So it's all on.
all right. Well, I'll, definitely interrupt me. I mean, this will be pretty quick. There's just a few slides here. So, basically, I just wanted to give you guys the background of how I personally did it. There's a lot of different ways to do this, but like we were just talking about, my initial interest at undergraduate was in international politics and economics, really. And then I was double majoring in Spanish. And when I got interested in medicine, I couldn't do that anymore because the course load was too much. So I sort of switched. But I think that baseline interest is part of what directed me towards doing the MBA, was because I was interested in sort of commerce and business to begin with. And so I thought along those lines. And then when I went to medical school, curricula have evolved a lot, but mine was still a pretty traditional two-year curriculum. So 2 years classroom, 2 years clinic. But what that did is it created a nice cut point where you could say, hey, I want to do something a little different here for a little while. And so that's what I ended up doing. I went to the dean, I did a bunch of research, and I went to the dean and I said, hey, I'm interested in doing this MBA. Can I take a year off or 2 years off to do it? And she said, sure, you just have to kind of figure out your time. And so the curriculum at medical school sort of facilitated that a little bit. So what I ended up doing is taking a year out between third and fourth year, basically, and going over to Oxford and doing the MBA. And that was not a healthcare focused MBA at that point, because this was in 2001. There were really the only place that sort of had any healthcare elective pieces to their MBA at that point was Harvard. It was, it just had a large class size. And so they were able to subspecialize a little bit, but no place else really did that. And a big part of the reason I chose Oxford is you could do it in a year. So they consolidated what was traditionally a 2-year program into a 1-year thing. And I knew that, I still had a lot of training to go. And so that's what I did. And then I went back and finished my 4th year of med school and then did residency and I went into practice. So that was just kind of the order by which I did things and sort of how that fell into being. And I'll talk a little bit about all the different ways you can do it now, because I think it's a lot more flexible and a lot more consumer driven for a lot of reasons. But just very generally speaking about MBAs, when people think about like why they do it, and this isn't just in healthcare, this is much more global, right? It's a very, very, healthcare is a tiny fraction of the people who get MBAs. And so why do people do it? And the main reason is really earning potential, and that in a lot of industries in the business world, if you have your MBA, it puts you into a slightly different echelon in terms of roles you can have in the, attendant reimbursement that comes with that. It's also a really kind of social degree in a sense, where you build a professional network and a group of people who you meet and interface with during the program. And those become people who are contacts that you work with in whatever it is you do subsequently. And that's really a huge part of what the degree provides you. There is the didactic academic piece, but like I'll talk about, it's a super general, it's almost like an overview degree until you choose some subspecialty. So a big part of it is really who you meet and who you know afterwards, in addition to what you know. For a lot of people, this isn't so relevant necessarily for people in our position, but it can be. It's an opportunity to kind of change your career path a little bit. A lot of my classmates were investigating whether or not they would go into a different industry afterwards. And in some industries like finance, for example, if you don't have your MBA, you're sort of capped out. So it goes back to the earning potential piece. A lot of the big disadvantages really is cost. I mean, it's super expensive. You got to keep in mind that the schools use it as an income generator, and they know that the reason you're doing it is because you want to make more money and you're in a position where you're going to. So they have no bones about charging you a lot for these degrees. So when you look, for example, at what the MBA at Oxford costs right now, it's about $120,000. So that's like pretty expensive. And so you got to think about that. And then there's the element of time, right? You're taking out time from either your career or your other training if you're in medicine, and it distracts you from what you're doing. So, I spent all that time, not reading, neuroanatomy and not doing surgery and not training. And so I think that you've got to have a real rationale for why you want to do it and why you're distracted from that. Or if you're further along in your career and you're thinking about doing it, why you're distracted from your family or your practice or whatever it is that you do to unwind from the stresses of your job. So there's some real disadvantages to doing it too. And that's something that everybody has to think about on an individual level. And but to me, one of the things that was really cool about it was, I don't have sort of a better term for this, but it was learning about stuff that you just aren't going to get in medicine, whether it's in the formal educational process of medicine or even in the day-to-day workflow of medicine. And that was kind of what interested me in a big way. Was I wanted to understand a lot of the pressures and factors that influence medical practice, both from like, how do I do this, to why do why do physicians move from here to there? Why do they move from academic practice to private practice? Why, how does the general economy or the health insurance marketplace affect what I do with my patients on a day-to-day basis? And that was really stuff that wasn't provided at all in my medical education. And I thought that was really fascinating. And so I kind of wanted to know stuff like that. So just kind of generally speaking, as I mentioned before, every MBA has a general survey component that's going to be pretty standard, whether you're doing healthcare or not. And it involves these courses that we talked about, things like, accounting and finance and marketing and negotiation and workflow and stuff like that everybody's going to need to do. And I literally just pulled this off of the Oxford MBA website. But increasingly now what's happened, and I think it's a good thing, is you can customize it. So there's a litany of elective courses that you can take. And as class sizes have gotten bigger and there's more focus on specific areas, those opportunities have grown. So if you want to do a healthcare focused MBA, that's super easy now. And there are, MHAs, like a master's in healthcare economics and stuff like that, that are administration, that you can do. So you can really customize the experience that you get, but you're always going to get that sort of core exposure. And part of that customization is the program itself. So the traditional MBA required you to do 2 years, and the first year was very didactic, and the second year was a little more experiential. And the 1-year program at Oxford was really nice because they consolidated that down. It was a little bit more academically rigorous, but coming out of med school, it was still very, very easy and doable. Whereas my friends who were coming from other industries, I think it was a little harder to deal with that. They all had the advantage that they had some experience in some of these courses. So they all knew at least something coming in. I was kind of like, I didn't know anything, but that was fun. Now they also have sort of hybrid things where you can do a master's in some other aspect of, economics or marketing or whatever, and then tag an MBA onto it the second year. You can do executive MBAs, right, which you do while you're still working. So those can be largely have a remote component, coursework focused on the weekends or in the evenings, things of that nature. And those are very, very popular. Yeah.
What's the executive? Because I did see executive MBA, I looked at the rankings. What's the difference between MBA and executive MBA?
It's the way that the course is structured. So, for example, those top two, the 1 and 2 year the top 3 are all full-time endeavors. Like you're there, your classes are during the day, Monday to Friday, and you're expected to do work all the time. An executive MBA may occur over a longer period of time, like maybe it takes 2-3 years, but you only have class in the evening or on the weekend, and it's recognized that you have a job that you're still doing. And so you're meant to get the same or similar educational experience. It just respects the fact that you're doing it while you're working at something else at the same time.
Okay. And when you get the certificate, is it an MBA or is it called an executive? It's an MBA.
No, it's the same. It's the same degree, yeah. And now there are fully online programs. And as I mentioned a couple of times, there are programs that are very healthcare focused. So you can really tailor it more so than you could 20 years ago. So you kind of asked the question, Aaron, of has it been useful or how has it been useful? And so for me now, I just kind of broke it down into what I did with that experience during different sort of phases of my career. And so in med school, it wasn't a lot because I didn't do it until I was a 4th-year med student. So it's not like I applied it a lot in med school. It was kind of a weird interview topic when I was interviewing for residency, because some people questioned whether I was really going to stay in medicine, whether I was really interested in medicine, or whether I was just going to train and then go to industry. And then some people asked me questions about like how I was going to apply it, and kind of had interesting conversations. And some people asked me tangential questions that actually had nothing to do with business. So anyway, it was kind of a little bit of a novelty, I think, for people interviewing me, but I'm not sure it really influenced med school very much. In residency, it was interesting because I was really interested, as I mentioned, in some of these larger scale macroeconomic things that influence medical practice. And so I ended up leveraging that to transition out of a laboratory environment into more of that type of environment. And I'll mention that a little bit. But then I think on a day-to-day basis, it really became a little bit more useful when I got into a faculty position. And Dr. Harbaugh's talked about this a lot already, but in terms of comfort and willingness to engage with things on the finance side, with working with your operations managers, with things like team building and understanding the marketplace that you're in. We're in everyone, it sounds like here is in a place where you are competing with your colleagues and other institutions. And so understanding the market you're in and how to leverage your competitive advantages in that space. I think you benefit a lot when you've sort of thought about that and when you've been trained in that a little bit. And then increasingly when you're in a leadership role, having some of those skills is really useful. So, I mean, every day you're putting together, we put together business plans and looking at finances routinely, and having leadership skills and a lot of the things that Dr. Harabaugh mentioned before. All those things were components of that degree, and things where you at least got some exposure to that and some exposure to people who are good at that. And then I just talked about using it in life in general, right? Like I talked about having a personal network that comes from your class, and some of my closest friends are from that class, and some of the most interesting conversations I have are with them because they're not in medicine. They're doing real estate and finance and these crazy things that I like only partially understand. And so I think from that standpoint, there's been a lot of personal enrichment from the people I know and things I've gotten to do with them. And then again, just comfort dealing with the dollars and cents in my own life and stuff like that is made easier by the fact that I've had to do that on a professional standpoint.
Can I just ask one question?
Yeah.
In terms of, do you feel that the MBA has made it easier and to deal with your administrators and vice versa for them, that you feel that there's a bit of filial, you both kind of have a same, then you each know each other's point of view? Do you think that has helped?
So I would say yes, but I want to temper that answer a little bit because all I have is sort of like an N of 1.5, which is to say, like, I know that I'm comfortable with our interactions and they're comfortable with me, and we work together very well. The half comes from feedback I've gotten from them that they feel like they've told me, at least, that I'm more engaged and more interested. Like it's easier for me to pick stuff up and move along with it with them than with other people who they work with or have worked with. I don't know how much I can attribute that to the MBA itself or the fact that I've always been a little interested, not in necessarily like the dollars and cents of making more money in what we do, but sort of in the global dynamic of how medicine works and healthcare works. And so maybe I'm more engaged and interested in this topic because of that. And it's not the MBA per se. The MBA is just a derivation of that. Mm-hmm. So I don't know that the MBA is going to take someone who's not interested and make them interested. Sorry, Dr. Harabaugh, what were you going to say?
Oh, no, I was just going to say, one of my faculty members, Mark Iantoska, you may know Mark, the pediatric neurosurgeon here who got his MBA a few years ago. And one of the things that it did was it gave him sort of immediate credibility with the administrative people. I think it just demonstrated that he had enough interest in that aspect of practice to take the time to get the degree. So, and he's done great with it. I mean, that was really a big step for him. And everything you've been saying is, fits with his experience, I'm sure.
Yeah, I think that's a really good point. Sort of the credibility piece, just sort of having the letters after your name in some ways helps. Yeah. So this I just threw up. These are a couple projects that I did during residency and early faculty, just to sort of show, I think these were things that I probably felt more comfortable doing and was able to do because of some of the background I got doing the MBA. And some of it was comfort with like large data sets, which I developed from doing kind of like computational analyses and stuff during my MBA. And the other one was just sort of ability, like questions I asked. And, you know, this was like a workforce project that we did. And so that was that. But I think today, as our careers move along, it's much more like routine stuff like this. So very regularly, I'm in meetings or doing stuff where you're doing like operations work, and you feel, I think I feel a little more comfortable with that, having had that exposure and that education, and market analysis and team building and leadership and things of that nature. You know, this is like figuring out how to budget for new faculty members and what the hospital needs to see in order to approve something like that. And then just sort of talent development and retention, and knowing like, okay, how do I engage with my team, and what do I need to do, and what do I need from them for the department to be healthy and vibrant. And I think a lot of that came from, or at least has a foundation in, some of those things I was exposed to during that educational experience. And so just kind of summarizing it a little bit, I think that an MBA is a very general, large degree where you get sort of a survey experience, and then you can customize it to what you need, assuming you know what you want to get out of it. Most people who do MBAs have been in the business world already. You don't do it coming straight out of university, at least in North America. And so you should have some idea of how you want to customize it and what you want to do with it. And a big piece of it is the people you meet, the people you work with, and the network you build. But what it gives you are tools that we don't get traditionally in medical education. And if you need those, it's great. If you don't, that's fine too. I think that there are easy ways to apply those things in almost any medical job, whether you're private practice, academic, or not, but some rely on it more than others. And it's important not to diminish how expensive it is, both in terms of finance and time and investment, you know, that's involved with it. So those are just kind of the quick summary pieces. And yeah, that's about all I had.
Thanks. Thank you. If, you know, it's certainly more and more neurosurgeons in UK are getting MBAs. And if it was your resident who asked you, would you say that it's your individual decision, or would you recommend it, Todd?
I would ask what they intend to do with it and what their longer term career goals and prospective path are. Because I don't think that, you know, there is a very significant opportunity cost of doing it. And so I would recommend it for somebody whose goals match that, you know, it's going to be of greater value on the back end than what the cost was up front, but that's not everybody. And so, you know, I have partners in my group who an MBA I think would be next to useless for, because it's just not what their skill set and interest are. But I have others for whom I think it would be great. So it's really a very much an individual decision.
Thanks. Dr. Harabaugh, nowadays, when I look at most of the chairmen, or enough of the chairmen that I see in US, they all have, many of them have MBA. So that's the impression I get. What's your thoughts, Dr. Harabaugh? Is that nowadays becoming, in the modern healthcare practice, understanding of management and finances is important? Or
Yeah, so I mean, I think you're right. It's become much more frequent. I mean, Todd, I suspect you were the anomaly when you got the MBA, but it's not unusual now. We've had a couple of our residents who have actually gone and gotten either an MBA or you know, a Master's of Health Administration during their residency. You know, this drives me crazy to think about it, but they think it's going to be valuable. But I think Todd's exactly right that for the right person, it can be really helpful. I mean, it's opened up a whole different area for Dr. Ian Tosca here. I mean, he's really moved up in the Penn State Health business hierarchy, and I don't think that would have happened without the MBA. I don't know what percentage of chairs right now have an MBA, but I'm sure it's becoming more and more common over time.
Thanks.
Yeah.
Dr.
And
Kiran,
I think there are a lot of alternative ways to get pieces of that educational experience without getting a full master's degree. There's coursework, there's all kinds of other things you can do to choose the pieces that are important to you.
but you would not get a title to put behind to show the credibility, show the
Yeah, I mean,
show you
that's where you have to figure
stuff.
out, what, where the value lies and yeah.
Thanks. Dr. Kiran, you mentioned that you have got an MBA as well through online. Is that right, Dr. Kiran? And how have you found it useful?
Yeah, I got a post-graduation degree in hospital management. It's not a fully MBA program, but it is a sort of administrative MBA program. It is more tuned to hospital administration. Like what you told, similar curriculum is there of, marketing strategies and other things. And some of the examples and books and other things are more to do with hospital. So as you rightly pointed out, I think these programs help when you know what to do with it rather than as an additional degree. And I took this quite late, few years ago, when I was almost head of the department and those kind. So it really helped me. And those now when I speak their language, they are happy. And in a new setup where I am, the governing council is almost most of them are non-medical. So it becomes very easy. And our director, when I present him the requirements and all the targets and objectives and other things, he just says, you just give me these things enough, and then he gets it approval. So in that way, it is much more easier. And it's helpful to analyze, as he has put a lot of statistics and other things. It helps us to look into a perspective. So I think it's a particularly MBA as a degree per se, whether it has a, scope and other things may not be necessary to have a formal thing. But some part of it, as he told, you can either do it in bits, let's say a 6 months program or 1 year programs in bits, depending on once you get introduced, say you want to do more, depending on your department. If, marketing is what you need to concentrate, then you can do that as a separate module. I think that kind of thing may work. But yeah, early in a graduation where you need to clinical work, shifting to management or doing MBA, I wouldn't recommend it until and unless he knows what to do with it.
Thank you. Dr. Harabaugh, in terms of the organizational neurosurgery, does having an MBA have a cachet in organizational in terms of committee chairmen and in terms of, you have been in the Congress, you have been at the Neuro Point. Do you think those will help? Or
Yeah, so in regard to organizations like the AANS and the Academy and Senior Society, that kind of thing, I don't think that it means a whole lot, but I think it does mean a lot within the individual organization. So if you're a chair with an MBA or MBA, then I think that you have a certain amount of credibility when you go to talk to your administrators, whether that be a hospital president or the dean or health system leaders, that it really carries some weight. So I think it's valuable that way.
Thank you. I'm just going to ask a last question to the faculty. I think, when we all went to, I'm absolutely sure, we all went to medicine. We thought that we are going into medicine to look after patients. And then suddenly, it dawned on us as we go through that it is not only a calling, but it's now a business. And how do you balance those? And then the business side is getting more and more, certainly in Britain, and we did not have this business mentality before because our health system was different. How do you still keep the clinical focus and what you went as a kid, 17-year-old kid or 18-year-old kid, and the reality of the world? How do you balance it, Dr. Harabaugh, then Todd and Kiran?
Well, as we've talked about before, Naren, I think, medicine is a business, but it's not just a business. And I think, we have to keep reminding people of that all the time. I mean, one of the things I see here is, there is a business culture. And, you have somebody you report to, your boss tells you what to do, you do it. Everything has to have a spreadsheet, and that culture is hard sometimes to integrate with an academic medical culture where you're questioning. If someone tells you something, I want to see the data. Let's discuss this. Maybe you're right, maybe you're not. And so getting those two cultures to interact is a challenge. And I think one of the important things about neurosurgeons being business savvy, whether it's getting an MBA or through other means, is to make sure that this doesn't become just a business. I don't think we can just leave the business aspects to our administrators. That's how we got in trouble, where we said, oh, well, I don't want to bother with that. Here, you take care of it. And pretty soon, they're calling the shots. And so I think, getting that business savvy, whether you do it the way Todd did, and, get the MBA or other means, it's important for us to be, understand that business culture and be able to work with it.
Thank you so much, Dr. Harabaugh. Todd, your thoughts?
Yeah, I agree completely. I mean, I think that the way that I think about it myself is the business piece of what you do is in service of the mission of taking care of patients, and recognizing that we function in a world where if you aren't, to simplify grossly, financially solvent, you can't provide patient care. If the hospital closes because it doesn't have enough money to function, you can't help patients. So that's how I intellectually sort of think about it. I think to get to the really important point that Dr. Harabaugh just brought up is having medical people in senior leadership of hospitals is really critical. And being in a hospital where senior leadership is constantly focused on and referencing the patient care mission, and that forms the foundation of their motivations, is really key to culture, to meshing that business, a functional business culture with the true academic mission. And my experience with colleagues who work in for-profit institutions that don't seem to have that is that the physician satisfaction rates are much lower, and there are sometimes patient care consequences that come with that as well. And so really being in an institution and maybe occasionally moving from an institution to one where senior leadership, who may not be physicians, but who should involve physicians, really demonstrates their focus on that aspect of the mission, and that the business is in service of that, I think is the best way, at least that I know right now, to marry those two cultures.
Thanks. I think that you make a nice point. Any reflection, Dr. Harabaugh? Do you agree with Dr.?
Yeah, fully agree.
And Dr. Kiran, you are working in a very not only a neurosurgery, but in a mission. I presume it's a charitable kind of mission, but finances still come into it. How do you juggle all those three?
Yeah, finance comes to some extent of it. It's divided into two things, like, the salary and operative costs need to generate, whereas some of the capital costs, like of the equipment and other bigger infrastructure, they are able to sustain from the corporate and other donors. So in that way, it is a good model because those costs do not add on to the patients. So that is one good thing. And I remember one, Dr. Yunus, Bangladesh economist, who is now the advisor, he was talking in one of the interactions. He told even charity needs to have a business plan. Otherwise, it is not going to have a sustain. So that doesn't mean that we need to show the big numbers. That's what I avoid. I don't like to promise in terms of, either number of patients or, those kind of things. I just say that because of this, these are the facilities which is going to improve and things like that. That is where I think the difference between ambitious and over ambitious comes in, where you are a little more grounded in promising what exactly need to be offered. So in that way, it works if you consider all of these.
That's great. Thank you so much, Dr. Harabaugh, Todd, and Dr. Kiran. It's really been, very thought-provoking, and I think I don't think similar discussions have happened before, as far as I know, anyway. And if all of you give you permission, I will edit it, and then I will post it. I think it will be a really useful reference to anyone for years and years to come.